Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. Friends, as we know, today also we will talk about a small topic which is quite interesting. Now, if you see nowadays, the concept of neonatal screening has been gaining the importance. We want to identify some of the disorders at the earliest so that the early intervention will be done and the damage which will have to happen or which will happen or the complications which occur can be prevented to a greater extent. One of such common screening program nowadays which is indicated, that is for the hypothyroidism. Hypothyroidism is a preventable cause of mental retardation. Therefore, if you are able to identify hypothyroidism in the first few days of the life itself, definitely you can prevent the more chances of mental retardation. Similarly, there is also the concept of the metabolic disorders. Nowadays, for about 30 to 34 disorders will be screened for the metabolic problems immediately after birth. So we can identify the metabolic inborn errors of metabolism at the earliest. So that will again helps to prevent so many complications. So we can take appropriate steps. So such a way, the concept of screening for the future disorders in a neonate is or infant is now gaining the importance. Of course, now when we talk about two important neurobehavioral disorders, that is ADHD and as well as the autism, these are also a very dangerous disorders as far as the child is concerned, because most of the time the diagnosis will be delayed. Again, these are the two disorders, especially autism is one such disorder. If it is identified at the earlier, the chance of recovery is more because of neuroplasticity, etc. The neuronal circuits will have more chance of getting proliferation if it is in the early part of life. That means before the completion of the brain growth. So such a way, this particular concept is now gaining importance. But when we think about this, whether there is any Ayurveda concepts regarding this particular infantile screening, yes, definitely it is there. If you look into one of the important chapter mentioned by Kashyapa, that is Vedanadhyaya. Now everybody says that Vedanadhyaya is explained for Avachya Shishu. That means to identify the suffering of a child which is not able to talk or express the feelings or suffering symptoms, etc. But if we thoroughly analyze this Vedanadhyaya, it is just not only limited to identification of some of the disorders immediately after the birth or in the infantile period. Rather, it will also act as a screening method for future disorders. Now, if you thoroughly identify the symptoms given in the Vedanadhyaya, now one thing, in the Vedanadhyaya, we should not go by the disease. He says in the Apasmara, he says Akasmat Atahasana. Okay. In the Unmada, he says Pralapaha. So like that symptoms are mentioned, and so many things are Mutakalecha Vedana is mentioned in Mutrakrutcha. Now what I mean to say is we should not go by the heading of the disease like Mutrakrutcha, Prameha, etc. given, but we have to go by symptoms. Now Akasmat Mutragamanam, if it is seen in the infant, or Mutakalecha Vedana, if it is seen in the infant, we should think that this should be a screening method for so many other urological problems. Now, if the child is having this Mutakalecha Vedana, then it should be treated as a screening methodology for all the urogenital problems. Similarly, when the child has got irregular behavior, irregular or abnormal behavior like Akasmat Atahasana, without any cause, the child is laughing, that in the early part of the life. So definitely that is not normal, it's definitely abnormal, and it should guide us to early identification of some of the neurobehavioral disorders. Maybe autism, maybe ADHD, like that. So if you are able to identify such a ADHD, autism, mental retardation like disorders in the first 3 or 4 months of the life, it is the greatest contribution they are giving to the society and also to the medical field, because you are identifying the disease in the earliest part. Now usually we know that autism will be diagnosed very late many of the times. We are not able to do that because of so many reasons. And if the child is diagnosed as autism at the age of the 3 years, then we cannot give much result to the patient. or if it is most of the time autism is diagnosed at the age of 5 years, preschool year. ADHD is mostly at the school age. Now, if you're able to identify the same thing in the early part, and that will be the greatest contribution, and because we can plan the treatment, and the chance of recovery is also more. So now, if you see the Vedanadhyaya, the whole Vedanadhyaya chapter is nothing but a screening methodology for so many childhood disorders. It should not be only limited for the presentation of the symptoms. Okay. Now, for example, asnata snata rupasya snatasya asnata darshanam. That means mentioned in ama. Now, this is not only for the ama. So, this particular symptom when it is present, it should be a guideline for the metabolic. That means inborn errors of the metabolism. That means if suppose child has got this particular presentation, and this child is most likely to have some of the inborn errors of metabolism because it is related to ama, and we can identify so many metabolic problems, inborn errors of metabolic problems, which is done by nowadays by the metabolic screening. Similarly, we can also go for the neurobehavioral disorders, neurological disorders, convulsive disorders, brain disorders, okay, cognitive disorders, and urological disorders, and even for some of the respiratory disorders. So what I mean to say is this Vedanadhyaya should be taken as a reference, or it should be taken as a screening methodology of the children, and it should not be simply taken as a symptoms. So if you try to see the symptoms, you cannot find much more presentation there actually. Okay, so for example, in case of Jora, it is told that in case of Jora, it is told that Padayohor Shitatvam Laratasya Atitaptata. Okay, now the typical nature of the endogenous fever, this is a fever which comes in children, usually follow this pattern. If the whole body is hot, then it is because of the fever, because of external causes, like environmental problems. But if only the head portion, lalatasya atitaptata, is hot, and rest of the peripheral portion, like padayoh shitatvam, that is indicate of the typical childhood fever. It will present like this. It indicates that particular peripheral constriction. There will be peripheral vasoconstriction is there, which leads to this padayor shaitam lalatasya atitaptata. So if you look into each and every symptoms, okay, in case of anahide is mentioned, arshas are mentioned, okay, shwasa is mentioned, hika is mentioned, so it will going to guide us the future disorder, to tell about the future disorder. So what I say is this chapter should be taken as a screening methodology for the future pediatric disorders which may occur in this particular child. With this I conclude. Thank you very much. Don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much. We will meet again.